Thank you for staying with us. And as I mentioned before the break, Ed, is there such a thing as the cause of cancer? You know, what does the Institute feel is the precursor to someone having cancer in their body?
There are many causes. The essential cause, and I'm not the scientist or the doctor, so I'm probably least equipped of our group to really deal with this, but the essential cause is genetic. Clearly there are environmental, there are dietary, these sort of considerations, but the things we have been focusing on in our basic research have been the genetic causes of cancer. And, you know, Robyn, 30 years ago, 35 years ago when the Institute was started, we didn't have any idea what caused cancer. And today we think, and we're very conscious about not creating false hopes or expectations, especially among the population of cancer patients who, you know, are so troubled and burdened by their disease, and the last thing they need is someone promising them something that isn't going to be there. But we really believe that we may well be on the verge of a golden era in cancer research, because we have learned many of the underlying principles that underline the biochemistry and molecular biology of cancer. We know it's essentially genetic. The role and the critical role that the immune system plays, and I understand you're going to be having Professor Jonathan Sabone on, and he can and will amplify on this, but the critical role the immune system plays in suppressing and combating tumor growth has been delineated. We've now sequenced the entire human genome. And we've developed the technology that allows us to rapidly identify potential molecular targets for improved treatment. So there have been stunning advances in our understanding of cancer over the last 30, 35 years. And those advances now dare us to translate those discoveries into improved treatment. And that's a challenge that the Ludwig Institute is embracing. It's a challenge that the Austin Hospital is embracing, and the Olivia Newton-John Cancer Center will certainly be embracing as well.
Okay. Before we go on to going a bit more in depth with some of those discoveries, when you say that it appears that cancer is genetic, can you just kind of explain in layman's terms what that means when you mean genetic? What triggers it?
There are certain genetic predispositions, and I would really leave some of the specifics better to the scientists and the clinicians. But for example, as I understand it, in breast cancer, there may be 6 or 7 specific mutations that need to occur in order for a tumor to actually become malignant. And if any one of those does not transpire, then you've got a benign situation and one needn't worry about it. So there can be this predisposition, but it's also an issue of probabilities, length of life, all these issues. Diet can play a role.
Okay. So things like, I don't know, lack of exercise, obesity, how much...
Sure, I think all those issues that affect one's general health. I mean, it's all... We're a very complex system, and that's part of... That's another serious challenge to try and deal with these things, because a lot of progress in understanding has evolved in terms of how various systems work in animal models and in the laboratory. But they're so poorly transferred to the human setting, and that's why what we feel is so important is that these early phases of bringing discoveries into the first-in-human trials are very much a discovery. They're not product development. So much of it right now, industry has to deal with in a product development mode, but it's really discovery. So we have to be patient. We have to be systematic about it. They are incremental steps. They're not big giant steps, because we're dealing with a precious commodity, a human being. So we can't just take shots on goal for the sake of trying to score on our first appearance on the field.
Okay. Now I know that you're working with, what's the word here? A treatment?
Cancer vaccines?
Yeah, can
Is
you
one?
please talk
Yes.
more about that? Because it can actually eradicate having to have chemo, is that correct? If this
Yes, the big focus of cancer research today is to try and provide targeted therapies for the patient. Radiation, chemotherapy have all had their successes, but they have a lot of collateral damage because they just don't affect just the tumor. So the objective of everyone in the field is to do what they can to target the tumor itself so that you're bringing in your toxic agent to kill the tumor and minimizing any of the collateral damage that might be done to the system. And we have been working diligently in two areas. One is targeted antibodies, but the principal focus right now are cancer vaccines. And these vaccines, unlike the vaccine most people are familiar with say, polio or the measles, which prevents you from getting the disease and are prophylactic in nature, the vaccines that we are working on are therapeutic. They would be a vaccine that one would take after they have gotten cancer. And the concept is to mobilize the immune system and focus it very specifically on the tumor that is burdening the patient. And we have made a number of discoveries in this field and probably have, or do have, a significant intellectual property portfolio associated with this. And we've been working on it since 1989 is when our first discovery was made in this field. We now have taken it through a series of very early first-in-man trials, and recently, last September, we mounted our largest clinical trial, which is centered here in Melbourne at the Austin, but going on as well as 18 other clinical sites in Australia, New Zealand, and the United Kingdom. And the hope is that after studying some 100 patients with this vaccine, that we will have a better idea whether indeed this does effectively target the tumors as we had hoped. In approximately 6 months, this is what they call a blind randomized trial, which means there are patients that are receiving placebo, and then there are patients that are actually receiving the vaccine. And neither the doctors nor the patients know which is receiving the placebo or the real vaccine. Those results will become unblinded in about 6 months, and we will begin to see what the results of the whole trial have been.
Okay, so you're saying this particular one first started in 1989?
The discovery was made in
discovery of it.
1989. This is a very, very tough business. It really does take
That's 19 years.
20 years
Yeah.
in our experience from the discovery to when you characterized it sufficiently to satisfy all the regulatory authorities that warrant it going into a patient. Sometimes it's a briefer period of time, but it is a painfully long period of time, and it takes real commitment, passion, and dedication to do it. These trials take sometimes a year and a half to accrue the patients that one needs. Then there's the treatment period, which can go on for 9 months. Then there is a period where you may have to wait 18 months or 2 years before you start to see the results. So you can see that a time horizon of 2 or 3 years doesn't work in this business. One has to have a much longer horizon.
Wow. Where does the holistic model fit in here? And by holistic, I also mean things like, meditation, exercise, etc. How does that fit into all those aspects that the Ludwig Institute is working with?
Well, we had to specialize in something.
Yeah.
So ours is more the basic research and then the translation of those early discoveries. But clearly, our objective and the ultimate test of what we do is the unyielding yardstick of human benefit. And so if we're successful in what we've done, which is in improving the treatment of cancer, you still have the cancer patient, and they have a lot of needs. They have the spiritual. They have the needs of their family. So all these go into making someone who is totally healthy and at peace with themselves. And I think if you are careful with your diet, if you are exercising, you are going to feel better.
Mm.
And I think if you feel better, you may well be better.
And build up
So
the
it's
immune
a
system.
key component. It's just not, other people are specializing in that, and we work with those people as we can, but our focus has been this particular niche to help complement the resources and the activities of everyone in dealing with the total patient environment.
Excellent. We'll take another break. And when we come back, we'll find out more about how the Austin Hospital and Olivia's proposed Cancer Research and Wellness Centre fits in with what the Ludwig Institute is doing.
Great.
Stay with us.